I want to talk about where we are today, and then we'll talk about where we're going tomorrow. Since the beginning of this situation, we have taken aggressive action. We closed schools, restricted businesses, and directed people to stay at home. We know that this work and the sacrifices of Virginians are delivering results. Together, we have slowed the spread of this virus. Our hospitals have not been overwhelmed, and according to at least one model, we may have seen our case count peak today. I hope that is true, but we must continue to work to keep counts low. We continue to watch the data. Our daily case numbers are still rising, as you can see from this chart, looking at the blue line on the top. But our growth rate is slowing. We see that our case count was initially doubling every 3 days, but now it is taking 9 days to double. That means the growth rate is slower. And hospitalizations rates remain flat. The yellow line at the top is total beds available. The orange line shows that those hospitalized with COVID-19 remains flat. The good news is that 1,600 patients with COVID-19 in Virginia have been treated successfully and discharged. And our PPE pipeline is flowing. We also have ordered 3 large decontamination systems to deploy across the Commonwealth as needed that can clean masks. We'll keep working to buy PPE and to help businesses figure out how to manufacture it. So we need to keep doing what we're doing, and we need to plan for that next phase. Our metrics for phase 1 are very clear. We need to see the percentage of positive tests and the number of hospitalizations both track downward over 14 days. We need to be sure we have enough capacity in our hospital beds and in our intensive care units. And we need to sustain our PPE supply. We will get back to work by greatly increasing our testing, then tracing the contacts of people who test positive and isolating these individuals, not everyone in Virginia. That is the key to moving forward. I'm going to step aside for just a moment and let Dr. Karen Remley explain how we're going to ramp up testing. Dr. Remley is helping lead our testing task force. Dr. Remley, welcome.
So as we work, I think the most important thing to say first, testing is driven by, in terms of the strategy, the governor and public health leaders behind me decide where we're going to test and how we're going to test. What this is looking at the different steps we need to take. We've moved from step 1 into step 2. Many of you who follow the numbers know that we've done 4,000 tests a day in the last 2 days. And what we're really doing is moving from just testing that priority 1 group, which were healthcare workers and hospitalized people, to expanding to people who are high risk. And that includes people with chronic disease, pregnant women, babies born to mother with COVID, and the uninsured and underinsured. As we do that, we're looking for ways to expand, and a lot of that is working with our clinical communities to make sure they feel comfortable and know how to do the test, and make sure we're testing across the state. And as you can see, as we move to the 3rd group, we continue to look at innovative ways to get testing to different communities, to be able to do large-scale testing and support all of the work of the health department as they do what Governor Northam just described, boxing people in, making sure we understand where that disease is and how we take care of it. And as you can see, these are rough estimates on how we can make this happen. In group 4, we're really at that point where we're able to do large-scale testing across the state, and that'll include looking at people who are asymptomatic to determine how much disease we really have throughout the Commonwealth. And then we all can't wait until we get to step 5, which is where we have just kind of an ongoing, very small amount of disease that we can pretty quickly be able to identify and to be able to isolate. With that, I'll turn it back over to you, Governor.
Thank you, Karen. I appreciate it. So moving forward, we will maintain this testing and tracing strategy. We will ensure that hospitals, providers, medical volunteers, and frontline workers have the PPE they need to stay safe. And we'll monitor our hospital capacity and use of ventilators, ICU beds, and medical staffing. When we see these metrics I've just outlined, fewer positive cases, more testing and tracing, more PPE, and steady use of hospital beds, then we can move to phase 1 of easing these restrictions. Phase 1 will still have heightened restrictions in place. Social distancing, for example, will continue. Teleworking will be encouraged and will also continue. We will still recommend face coverings in the public. For business to resume, both customers and employees must feel safe. To create our Forward Virginia blueprint for phase 1, we have been meeting with stakeholders, local governments, and business leaders. We have put together a small work group of representatives from businesses large and small in every corner of our state. It includes barbershops, theaters, hotels, and campgrounds. We're talking to manufacturers like Volvo trucks, restaurants like Mama J's right here in Richmond, and entertainment venues like King's Dominion and the Barter Theater. Faith leaders will also be part of our work group. We want them to tell us what is the right way to ease restrictions. What will that look like on the ground? What is practical in real life and what is not? We will use their input as well as input from dozens of Zoom meetings we've had with local government officials, business associations, hospitals, and health associations, and other groups to develop 2 sets of guidance. We'll have overarching rules for our businesses, as well as industry-specific guidance for sectors like restaurants and non-essential retail. This will help make sure that everyone knows the rules of how they must operate when it is safe to do so. As we go forward, we will fill in the details of the phase 1 blueprint and develop plans for phases 2 and 3. I am as eager as anyone to move into the time where we can ease some of these restrictions. But we must do so in a safe manner, one that seeks to avoid causing a spike in cases or a surge our hospitals cannot handle. As I've said before, we cannot and will not lift restrictions the way you turn on a light switch. We will do it responsibly and deliberately, and it has to be grounded in data. We will move forward, but in a way that prioritizes public health and creates public confidence. Easing too much too soon could jeopardize public health and consumer confidence. 1 step forward and 2 steps back is no way to move ahead. We will need everyone to continue taking actions to keep themselves and others safe. When you cover your face in public or stay 6 feet away from others, you aren't just protecting yourself. You're protecting other people, and that is the most important part of these efforts. None of us is in this alone. All of our decisions impact other people, other Virginians. I continue to be grateful to our medical professionals, our frontline workers from hospitals to grocery stores, and everyone in Virginia who is staying home and making sacrifices to help us get through this together. As you have heard me say many times, we are in the middle of a health crisis as well as an economic crisis. And as soon as we together can get this health crisis under control, as soon as we can put this health crisis behind us, we will be able to get our economy up and running again. So I thank all of you for your cooperation. Now we'll